Hi everyone, welcome back to Everyday Health Savvy. It's Cynthia here. So I hope you are all doing well. So I wanted to talk about something that a lot of people experience but nobody really talks about. But it affects so many individuals living with diabetes. So we are talking about how diabetes can affect your intimacy level, your desire, your comfort, your energy, and your connection with your partner. So whether you have diabetes or care for someone living with it, this video will help you understand what's happening inside the body and why intimacy may feel different. So I'm going to explain everything in a simple, respectful way and share a real step you can take to feel better. Before we get into the medical side, let's start at the beginning. Understanding what intimacy level really means will help the whole conversation make sense. So let's begin with that. What exactly is intimacy level? When we talk about intimacy level, we are talking about your desire for closeness, your emotional connection, your physical response, and your overall comfort with intimacy. So your intimacy level depends on many things. Your hormone, your mood, your nerves, your blood flow, your confidence, and what else? Your emotional well-being. When diabetes affects your body, it can also affect your libido or your desire for intimacy, and this is completely normal. So now that we understand what intimacy level really is, so let's talk how diabetes interferes with it. One of the biggest reasons intimacy changes is because diabetes can damage small blood vessels. So when blood doesn't flow well, the body doesn't respond the same. So for men, this may cause difficulty getting or maintaining an erection. For women, this may lead to dryness. So it's not a lack of love or attraction. It is the body not getting the circulation it needs. In blood flow, it's not the only thing diabetes affects. The nerve also play a huge role. So neuropathy usually starts in the feet, but it doesn't end there. Diabetes can affect the nerves in the pelvic area. This can cause reduced sensation, difficulty climaxing, low libido, less physical response, and it can also reduce desire for intimacy. So I want you to understand that this is medical, not emotional or personal. So now let's talk about another major factor, your hormone. Okay, your hormone. Diabetes affects hormones in both men and women. So now let's start with men. So for men, it can cause low testosterone, low energy, can also reduce desire for intimacy. And for women, it can lower estrogen. It can also cause vaginal dryness, discomfort during intimacy, and it can also cause your libido to be low. So when hormones shift, your intimacy level shifts. So, and hormones are not the only issue, but blood sugar itself affects intimacy. All right?
So now that we understand why intimacy changes, let's talk about how these changes show up in men versus women. Men may experience difficulty getting or keeping an erection, reduced morning erections, low testosterone, low energy, and also reduced desire for intimacy. This can affect confidence, but again, this is medical. So now let's look at the woman's side. Women may experience vaginal dryness, pain during intimacy, lower desire, reduced sensitivity, difficulty climaxing, and recurrent infection. So many women feel like something is wrong with them, but this is simply diabetes affecting their body. So the good news is that there are many ways to improve intimacy, physically, emotionally, and medically. So let's talk about the solutions. First, control your blood sugar. This is the foundation. When blood sugar improves, hormone balance better, blood flow improves, and energy returns. So, and while sugar control is key, movement is the next powerful step. Exercise regularly. You don't need a gym. Walking, dancing, anything to increase the movement helps blood flow and boosts hormone. Exercise naturally increase libido for both women and men. So next, something very simple but important, hydration. Hydration helps with comfort, lubrication, and energy. Okay? So stress affects intimacy more than people realize. All right? So try deep breathing, prayer, meditation, walking, relaxing activities, and talk to someone you trust. All right? So when your mind is calm, your intimacy level improve. And sometimes you need professional help. Okay, talk to your doctor. Ask your doctor about hormone checks, testosterone levels, medication for erectile issues, treatment for dryness, and emotional health support. All of this can restore intimate well-being. And for women especially, here's a very practical tip. Use lubricant or moisturizers. Okay, so this can make intimacy comfortable and help restore confidence. So, and one more thing, communication is everything. Improve communication. Talk openly with your partner. Share how you feel, what is changing, and what you need. Understanding builds connection. Now, here are signs that mean you should talk to your doctor. So, seek help if you notice persistent erection problems, pain during intimacy, severe dryness, a major drop in libido, signs of depression or anxiety, new symptoms after starting medication. So getting help early leads to better result. All right, so let me end with some encouragement. You are not alone and you are not broken. Diabetes affects many parts of the body, including intimacy. But with the right step, controlling your sugar, exercising, hydrating, managing stress, and communicating, your intimacy level can improve. You can feel like yourself again. So thank you for staying with me through this important conversation. If today's video helped you, please like, share, and subscribe to Everyday Health Savvy. Comment below if you want a part 2, maybe natural herbs that support intimacy or tips for emotional connection. Stay healthy, stay aware, and stay connected. I will see you in the next video. Bye-bye.